Welcome to Onslow County Today. I'm your host, Lisa Whitman-Grice, and today we are celebrating the 15th anniversary of Onslow County Today. We have some wonderful guests joining us today. We'll be talking with County Manager Mr. Jeff Hudson, who actually established and started Onslow County Today 15 years ago. We'll also talk with Captain Donna Pauly about summer heat safety. We'll be talking with Lindsay Wolf from Onslow County Animal Services about keeping our pets safe in the summer. And finally, we'll talk with Stacy Scruggs with Onslow County Home Health and Hospice about the new Parkinsons support group that they've established. We thank you as always for joining us for Onslow County Today. Welcome back to Onslow County Today, and joining us now is Mr. Jeff Hudson, Onslow County Manager. Mr. Hudson, thank you for joining us.
Well, thank you, Lisa. It's good to be here.
Now, as you well know, this is our 15th anniversary of Onslow County Today, and I don't know if our viewers know, but really, this was your brainchild. Tell us a little bit about that.
Well, it seems like a long time ago now, right? But back 15 years ago, I realized that we had access to a public access government channel on television, and I didn't believe that we were fully utilizing it. We had always depended on other people to tell the stories and the news in Onslow County. And when you do that, if you rely on any newspaper or any media outlet, they will tell a portion of the story, but they may not tell all of it, or they may not devote the time or the column inches to tell everything that the public really needs to be informed. And sometimes, of course, we know that media across the country has sensationalized things. And so I thought, well, we have something that money can't really buy. We have a television channel devoted to public access, and we just weren't using it. So we thought about Onslow County Today. Let's tell the good news and the educational portions of what county government does, and let people make up their own minds about the services that we provide.
You know, it has evolved in the last 15 years. We've dealt with different sets. Our first set was in a warehouse, so yeah. Every time there was thunder or a helicopter, production ceased. Moved a little bit. We were in the courthouse. We were working with our neighbors at Jacksonville City Hall, and now we're in the new Onslow County Government Center, working with our Public Information Office and our new set. When you think about that evolution, could you have imagined that 15 years later this is, or maybe this is exactly what you had in mind?
No, we're in front of a green screen right now on a virtual set, and there's no way I could have imagined that. The one thing that I could imagine that has continued on through 15 years has been just a revolving door of really great public servants that come and talk with you, Lisa, and have informed the public about what we're doing in Onslow County. I know that today we're going to be talking about pets, and we're also going to be talking about the heat and everything in eastern North Carolina summertime. And I'm so pleased that after 15 years we've been able to consistently give the information, even though the location has changed and technology has really changed. We're able to do it efficiently. We're doing this in-house, and we're able to get the message out. So that's just been a real thrill for me.
Well, it has been a great opportunity over 15 years to meet so many dedicated public servants. And we've had everything from emergency services and preparedness to senior services. So I think it introduces the wide range of services that Onslow County does. You use a phrase all the time, and I quote you on this, is county government is where the rubber meets the road. And I think that we've tried to share that a little bit. In talking to members of the community, what about the feedback that maybe you've heard about just those public servants?
Well, I think that it's natural in America for us to look at public servants in Raleigh or in Washington or in our state capital, if you're not in North Carolina and Washington, and realize that the farther away you get from local government, truthfully, the more removed you are from the local problems and the day-to-day issues of families in a community. And so what I've heard over the years, and this is my 22nd year in public service, all of which has been here in Onslow County. What I've heard over the years is people just didn't realize, as you said, the breadth of local government service. A lot of times, we're all leading busy lives. I'm afraid I talk to my wife Angela once in a while about work, and to me it's right there in front of me, right? And I think about all of the difficulties that we have or the issues that we're facing, and once in a while, I say to my wife, I just don't know what we can do about this. And she said, well remember that for the general public, they're all facing issues just like you're facing. And for her, it's her job, and for other people, it's their jobs. And sometimes in the activity and hustle and bustle of our daily lives between family and everything else that we have going on, we're not focused on the services available to us. So if we, through Onslow County Today and through the use of G10, G14, can let people know that they can go and receive help from Onslow County Home Health and Hospice, if they can go and get senior services assistance and the health department and all of the other things that we provide, maybe we can make their lives a little bit easier.
Well, you mentioned that change in those variety of services, and just in the 15 years that we've been doing this, the county itself, demographically, population certainly, growth of the county, and then the provision of services that we offer here in Onslow County has definitely evolved as well. So if we look back on the 15 years, Onslow County has just become a different place in many respects. Can you share a little bit about, as the county grows, how you're really looking forward? We look to the past because we're talking about anniversaries today, but really Onslow County is all about looking forward.
Well, it is, and we've become an urbanizing county, and county government over the last, especially the last, I would say 6 years, 7 years, has started more and more professional examination of our processes and procedures. We look at the fact that we have to be data driven. We just went through a budget, and in going through the budget, we said over and over again we have to be data driven. Onslow County operated in fiscal year 16 with a zero-based budget, with all of the dollars being justified. And if justifications weren't available, then things weren't funded. I don't know that 20 years ago or 15 years ago that was the case. People may have done budgeting differently. We may have looked at services differently. But today, in 2015, when you're looking at a population that's urbanizing, a population that's so diverse that comes here from many different places, and those individuals have called Onslow County home, they are bringing different expectations about the types of service and the levels of service that they expect from county government. And in order for us to be responsive, that means that sometimes we have to expand our service provision. At the same time, we have limited resources to do that. So from a county perspective, being more responsive to the public and using data to determine where we're going to place our efforts, that's been very important. And we've also had, I believe, in county government, a change in attitude as well. We have tried very conscientiously to create a culture of service.
Yes.
We want our employees to know that they are valued, but also that we have to be responsive to the public, that we're here to serve the public in every department, and we no longer expect departments to be siloed. And by siloed, I mean, and this is something, by the way, that private industry, corporations face when you have different departments spread out over a large organization like the county, and a department thinks about its own mission, and it doesn't think sometimes about how its mission interrelates with the mission of another department or the overall vision of the county. So we've tried to break down those silos, and sometimes we've done it through just overall reorganization, like Consolidated Human Services.
Well, I think even the building where we are today is a great example of that. You have multiple departments providing that efficiency and convenience for our visitors and for our users, and for our citizens, and yet being divided by floors versus being divided by miles makes a whole huge difference in the delivery of service.
I'm going to use that. That's a good one. I mean, divided by floors instead of divided by miles. That's true. I mean, before, if I had to go to finance or human resources, I would drive 15 minutes one way and 10 minutes to the next stop and 15 minutes back to my office. And it's really hard to manage that way, and it is hard to gain that spontaneous brainstorming that sometimes has to happen to solve a problem, or instead of delaying a call, maybe someone just walks across the hall and together two departments figure stuff out. Yeah, it's been a big change with one-stop shopping in Onslow County.
Well, you know, as we're kind of closing out our segment and continuing our celebration of our anniversary, I want to thank you for this opportunity, and over the course of many, many years, coming on Onslow County Today and sharing with our citizens your vision, the vision of the Board of Commissioners and your entire leadership team and all of the county employees about how we all do come together for one good, and that is for the service of our citizens.
Well, thank you, Lisa. You know, this is home, right, for all of us. We employees of Onslow County, we live here, and there's nothing more special than to help serve our neighbors. So I appreciate being here, and thank you for the good work you've done for 15 years. You probably didn't expect 15 years ago that we would be here either, and you've done a great job. And thanks also to our many department heads and departments that have come on to give that information to the public. So thanks.
Thank you, sir. Welcome back to Onslow County Today, and it feels good inside, but boy is it hot outside. And we are joined now by Captain Donna Pauly with Onslow County Emergency Medical Services to tell us what we need to do to stay safe in this heat. Captain Pauly, thanks for being here.
Thanks for having me, Lisa. It'd be great to talk about some of the heat-related emergencies and different things we need to look out for and look out for one another just in case we are becoming succumbed to this intense weather.
Well, you know, we were talking earlier off camera that this does seem, and maybe it's just because we're in the moment, and it just seems hot sooner this year and a more intense kind of unrelenting heat. And for those of us who kind of ease into the summer, there's been no ease this year.
There certainly has not. Summer has hit us full boom straight ahead, and it is humid as ever. The storms don't seem to be coming to knock down the humidity, and it's just been unbearable. And
with that in mind, we certainly want to be careful in really any kind of outdoor situation. So what we want to talk about today is kind of how to recognize the symptoms of a heat-related condition. We want to talk about what we can do, and certainly why we need to look out for our neighbors, especially. So let's begin by, I know that you all have had not a record-setting year, but your numbers for response statewide have been pretty high this year.
Absolutely. We've noticed a lot of calls coming in. They could come out anything from a general sick call to a person possibly in cardiac arrest, and it's due to the inclement weather that we're having with the excessive heat. I actually looked at some stats last night before coming in today, and there have been over 129 different calls at hospitals across North Carolina directly related to heat-related emergencies, and that's in 1 week. Over the course of a month, it's been almost 450 calls where people have had to go to the emergency departments due to heat-related illness.
Now, you mentioned it could be from just kind of a general sick feeling to things that are very extreme. So can we talk about kind of how we define those conditions?
Absolutely. Well, the most common thing that we see is something known as heat cramps. And basically, as we start to work our bodies and we start to get hot, our body's defense to that is to perspire. The perspiration on the body, accompanied with cool air, will naturally cool the body down. But when we start to perspire a little bit too much, we start to lose salt, which is very necessary for our body to progress. So the person will start to experience cramping. So they might start to feel a little bit fatigued, excessive sweating, excessive thirst, maybe a little bit of nauseation, and large muscle groups will start to ache to the point where muscle cramps, Charlie horses, and they'll start to feel very, very poor in general speaking. And that's usually the most mild case that we have. We start moving into something a little more severe, which is heat exhaustion, where you're going to see where the patient's skin turns bright red. They are sweating profusely, very dehydrated, but now you start to add possibly altered mental status, general weakness, fainting, overall, again, poor general feeling, but it's a lot worse than the muscle cramps. But you can also get the muscle cramps going along with that particular condition. And then you move into the most serious of the heat-related emergencies, and that's going to be your heat stroke. Heat stroke, the person is going to have an altered mental status, bright red, dry skin. They're no longer able to perspire, so the body cannot control the temperature. This is extremely dangerous, where it can start to affect the brain, body temperatures start to go up, and it can ultimately kill the individual.
Now, when we talk about those extreme conditions, you know, from progressing, really, when you first notice that muscle cramping, the general, what's the first immediate step we should all take?
Well, the first thing is to cool yourself off. You want to find somewhere where it's shaded or go inside where there's some air conditioning, and you want to drink plenty of water. A lot of people think that drinking soda or tea or coffee is going to cool the body off, and there's caffeine in those products, which is actually a diuretic, which makes you sweat more. So stay away from stuff like that. Stay with the water. Usually a cup of water every hour or so is pretty good measures if you're going to be out in the heat for a little while. Try to avoid heavy meals. And when you start to get overheated, just cool yourself off.
What about, you know, sometimes you see, and there are certainly members of our community who have to be out working in the heat. What about other measures that we can take? You know, you sometimes see the cooling towels, or I think they're called, you know, a lot of athletes use, what is it, frogs, you know, that sort of thing. What about the effectiveness of something like that? Do you encourage people to do that?
Absolutely. If you're in a position where you're outside all the time, it's very important to take frequent breaks. And I know a lot of times that's difficult to do, especially when you have a job that has to get done. But taking those breaks is important, and especially taking in a lot of fluid so that you can help reabsorb some of the fluid that you have lost from the perspiration. You can wear the cooling towels. You can dress lighter while you're outside, maybe wear a hat to shield the sun from your head. And when you notice that you're starting to get thirsty, make sure you stop and get a drink.
And I've often heard some of your colleagues say, even before you get thirsty, it's almost too late, that really you need to be drinking.
It is, and it's not a topic that you really want to talk about, but when you're noticing that you're not even using the facilities very much, you're behind the 8 ball. So even the color of your urine can indicate a little bit of dehydration if it gets a lot darker than a normal lighter shade.
So stay hydrated, stay cool, take frequent breaks. If then you do, without really realizing it, become ill, either heat exhaustion, heat stroke, first course of action then is to certainly.
Absolutely. If you're the one being affected, call for help immediately. If it's somebody that you know, try the cooling measures, and if the person isn't responding well, they're not cooling down, go ahead and call 911 immediately and stay with the individual until help arrives. When you start the cooling process, it's something important. You naturally want to wipe the sweat off of somebody's brow. We actually discourage that because that perspiration is still cooling the individual. If you have a means to maybe pour a little bit of water on the individual, wipe them off with a cool towel, and even fan them with some papers or your hands just to get that breeze going across them, that'll help. If the person's not responsive, maybe turn them on their side, so that way in the event that they start to vomit while they're unresponsive, they don't choke.
Right, right. So call 911 and then do everything that you can within the confines of where you may be to keep them cool,
Absolutely.
cool them. And the fact that you pointed out, don't wipe the perspiration away is a point that I would have never considered. So what about trying to hydrate them? Does it depend on their state?
Absolutely. If you have something to give them to drink and they're able to drink it, they're completely responsive, cooling them off and having them drink something, small sips of water to begin with. If you have Gatorade or one of those other type of drinks that replace electrolytes, of course that's good to do in moderation. You don't want to be excessive when you drink them because that can cause problems in and of itself.
Okay.
And as long as they're able to tolerate taking small sips, absolutely, that'd be a route to go.
Okay. Well, we've got some great advice on what to do, but what about what we can do to watch out for our neighbors, maybe special populations like our senior community? What can we do there to make sure that they're well taken care of?
Absolutely. You'd want to go around and check on your neighbors, maybe phone a friend just to check in on people. If you know somebody doesn't have an air conditioner or maybe they only have a window unit, they can be provided with a fan free of charge through senior services.
Okay.
They'd have to make sure they're over the age of 60 and bring a valid ID card and just go down and they can pick up the fan, and that will also help cool them off. So there are little things that can be done all over the county, not just by your neighbors, but by the county itself to help them out.
Now, the last thing I want to talk about is certainly we have people from all over the world.
Yes.
And, you know, we joke, oh, it's not the heat, it's the humidity. But I have a friend from Arizona, and she said, it's 110 degrees there all the time. She says, but I've never been this hot. What can we share with our viewers who might think, oh, it's just a little heat, but it feels very differently. It manifests itself very differently. Talk a little bit about just awareness.
Well, when the humidity is a big thing. Here on the coast, you know, you have the water and the storms come in, the storms go out, and the humidity level always seems high. It seems excessively high during this current time right now. Whenever the humidity levels are higher, it actually intensifies the actual temperature. So where you might think it's only going to be 90 today, with a heat index and the humidity at 60%, it can put that temperature well above 100. So it actually feels a lot hotter. And with humidity and direct sunlight, a lot of times it's harder to cool the body off. So it doesn't matter where you've been, what part of the world you're from, heat is going to be different everywhere. And just make sure that you stay hydrated and well prepared for signs and symptoms if you should see some.
Well, you know what? I can't think of a better way to end that. Just being aware, stay hydrated, and stay cool if you can, and watch out for your neighbors.
Absolutely.
Well, Captain Pauly, thank you for taking the time to come in and share with our viewers about what they need to do to be safe in this heat.
Thank you very much.
Welcome to Onslow County Today, and joining us now is Lindsay Wolf, Director of Onslow County Animal Services. Lindsay, we're so glad to have you.
I'm super excited to be here.
You know, when we were talking with Mr. Hudson earlier in the show, he was talking about the changes in county government and the changes in the way in which we deliver services. And I think a great example of that is your department. And really the evolution from animal control to animal services. Talk a little bit, just if you will, before we get into the main part of our conversation, about that evolution and what that's meant to you and your staff.
Yeah, it used to be animal control, and now when we moved into animal services, we're trying a much more community outreach perspective now, and animal sheltering across the country is changing. North Carolina's been a little bit behind the times, but we're finding that the other counties are really engaging now. They're engaging their community. They're trying to offer different services. So we've just been expanding our services, and we just started social media last year, and it's exploding. It's so positive. We've gotten so many donations and positive support, and now we've implemented a foster program and rescue groups, and so we're just really expanding, and we're trying to do educational outreach and just be really proactive in the community.
Well, I do. I follow you on Facebook, and I love to see the new family stories,
Yes.
the adoptee stories, and when the cats and the kittens. Oh my goodness! And we know summertime is kitten time,
Yes.
and dogs and puppies in your all of the pets that you have there, all of the animals that you have there, when they find that forever home is just really touching to see that.
Yeah, it's super heartwarming for the staff too, especially the ones that maybe have a little bit of special needs or have been there for a really long time. It's extra touching for us. We all get really excited, and then we love to see the posts on Facebook with the families posting the pictures, and we're like, oh yay, they're in a bed now and they're super happy, so it's exciting.
Well, you mentioned that a really important component of what you do is education. And that's why we wanted to talk with you today, because with this intense heat, as we talked with Captain Pauly about, it doesn't just affect people, it affects our pets, it affects livestock. And so we wanted to have you here, Lindsay, to talk to us about things that we can do to keep our pets safe in the summertime. And let's start really with the heat.
Yeah, definitely. The heat is super difficult on pets, so it's really important for shade to be provided to animals at all time, and keeping in mind that the sun shifts throughout the day, so just making sure that maybe you're not home in the afternoon, but just thinking, where is the sun going to be at that point? You really want to provide them with shade and fresh water. That's very important, and maybe putting a little bit of ice cubes in it, especially in these 100-degree days that we've been having. Ice cubes are a help, or maybe providing a frozen Kong, putting in some yogurt, some banana, freezing it, allowing them to have that throughout the day. That's incredibly helpful.
I actually saw where a friend of mine is giving her horses popsicles. And so it's flavored, healthful and animal safe choices, and then making them their own popsicles.
And with the popsicles, you can do beef broth, chicken broth, freeze it overnight. They love it. It's great. And I've also had a different shelter used to fill up water balloons with some stock, and then they would freeze them, and then they would take the balloon off, and you have this big chunk of ice for the animal to lick on.
Very good, and also a little bit of entertainment.
Exactly, enrichment. We're all about enrichment now.
Exactly.
Yeah.
So they're not bored.
Exactly.
If they are in the house in the summertime, they're cool. They also may not have the kind of stimulation that they need if you're not there all the time. So you also want to keep that in mind?
Definitely. That's why we like our Kongs, we like our toys, our Nyla bones, any interactive games, maybe hiding food throughout the house during the day so it takes them a little bit of time to find it. Anything to reduce their stress and just keep their mind occupied.
Very good. So definitely heat. And the one thing, and I don't think we can share this message enough, is how important it is. We love to have our pets travel with us, but the dangers of pets and vehicles. Please, I know we can't stress that enough. Please do.
And it's actually against state law now to keep your animal locked in a vehicle. Even if you have the windows down, which sometimes we think, oh, well, our animal's in the shade, we'll just leave the window down. But even in a 70-degree day in the shade, if you leave your window down, your car can climb to about 80 degrees, about 85 within 10 to 30 minutes, which is terrible for our animals. I mean, if we wouldn't leave our child in the car, we wouldn't want to leave our pet in the car either. It's the same thing. So we just encourage that if you do have to run into a store, leave your car running if you can. Some cars have the ability to lock them and still keep them running. Unfortunately, mine does not. So I just can't take them anywhere, but I know some people do have that ability. So just make sure that your car is running, or someone stays in the car, or just leave them at home. And just don't take them unless it's on a trip that you can definitely take them in the store with you. As we've been traveling with our dog, I've noticed more and more businesses
that make special allowances for people with pets. Maybe they leave out bowls of water outside of their establishment. So there really are we're making strides in our family.
We are, yeah. And you know, I always recommend talking to the businesses too, because some of them who have the outdoor patio areas, they might allow your dog to be out there. And I travel frequently to Raleigh with my animals, and I'll sit outside with them, and I just ask them to bring me a bowl of water if they don't have one, and they always provide one, so they're really great.
Now, we've talked about the heat and vehicles, but there's another aspect of the heat where we get home, we're ready to go for our walk, and maybe that pavement has not cooled off to where it needs to be to take our pets for their walk. Talk a little bit about paw protection.
You know, when it's about 85 degrees, it's normally a little bit too hot to walk your dog. So we really recommend early morning walks when it's not as hot, or late at night after the sun has set. Otherwise, it's a little bit too hot and exhausting. Or you have the option of wearing booties or socks. Not all animals like them. They think it's, you know, ridiculous, but some love it. Some love clothes. So if your dog likes booties, or even your cat. Some people really like to walk their cats. If they like the booties and they're receptive, definitely, then you can walk them anytime. Otherwise, maybe take them for short walks or walk them in the grass instead if you really do need to walk them, and just try to keep them off of pavement, asphalt, concrete. Even the beach sand can be a little bit too hot for them. And I find also, in addition to the beach sand, animals aren't always looking for the jellyfish or the seashells, so you really want to watch out for that as well in the summer.
Well, when you mentioned the beach, that immediately makes me think of sunscreen, and we wouldn't think that our pets need sunscreen, but they can be in fact very sensitive to sun. So talk a little bit about how important it is if you have, for example, a breed that might have a lighter fur or hair coat.
We find a lot of the pit bull mixes, especially the white ones, their skin is right there because they're so they have such short hair. Long hair dogs, the dogs with undercoat, not as big of a problem. They're kind of made for that environment. So any light haired dog or your pit bulls or anyone with really thin hair, go ahead and put some sunscreen on it. Do a little research. The dog stores will provide some. You can probably make your own. There's a lot of things out there, different oils that you can put in their fur to help prevent the sunburn.
And when you mention their fur, I also think about fleas, ticks, and heartworm prevention. And summertime, again, it's always a concern, but summertime even more so.
Oh, even more so, definitely. The ticks and the fleas are super prevalent in the summer. So we would recommend topical treatments, oral treatments for those. You can also add some things to their water, some nutritional yeast. Some people add like a little garlic. You can do natural remedies as well to deter them. But heartworm is a huge problem. We see a lot of heartworm positive dogs come into the shelter, and it's very sad because it's such an easy preventative task that someone can take. It's a little expensive to have the tablets. It really depends on which brand you want, so I'd say shop around to different vets and look. But heartworm is transmitted through mosquito bites. So if you're out in the beach and a mosquito bites your dog and he's on a heartworm preventative, he could pick up heartworm disease. And it can be very expensive to treat, a couple $100s.
So prevention
is key, and it'll save you money in the long run.
So we've talked about the heat, we've talked about the sun, and potential parasites. But you know, there are things that we don't even think about our pet necessarily with the summertime, and that's things like picnics and celebrations. I mean, that should just be fun. So 4th of July or family picnics, and the pet's there and we're all playing and we're throwing frisbees, but there are some hazards and some things we should be mindful of.
Definitely, especially with upcoming 4th of July. That's one of the biggest times a year that we see the most amount of dogs that have escaped or run away because the loud noises are terrifying. So we recommend leaving your dogs at home and in securely locked, windows shut, doors locked if you're going to go see the fireworks. If you are going to bring them, just make sure that, you know, their collar, their leash, everything's attached very firmly. Make sure their tags are up to date. Make sure that their microchip's up to date in case they do get lost. And then if you're playing with sparklers or fireworks, keep the dogs away from that. You know, they're very curious creatures, so they may want to sniff that, and maybe the sparkler gets a little too close to them. Also keeping your animals away from the grill too, just to make sure that we don't have any fire hazards with the fur. And then just making sure that, you know, you keep them close to you during those times.
And the last thing we kind of wanted to talk about, which there again it's not something we're always mindful of, but is pool safety or water safety with our pets. We think, we see television commercials and you throw the ball in, but not every dog is a natural swimmer.
No, not at all. We really do not recommend just throwing your dog or cat into the water. Not all of them know how to swim. Sometimes they can kind of use their front paws, but they don't really know how to use their back legs. So we encourage just easing them into it, slowly but surely helping them learn how to swim. Also knowing that some dogs just will never swim. Some breeds can't, but amongst those, bulldogs and pugs, while they may not be able to swim naturally on their own because they have the shorter legs, if you leave a life jacket to them, they're a little bit easier to swim. But we really recommend watching them closely, the same as you would with children, maybe fencing off your pool or fencing off the area for access to the water, the lake, or the river if you have one behind your house, just so that you can supervise them at all times, because dogs can drown just like humans. So, it's the same with the beach. Look for the current, look for rip tides. They can get caught in that easily. And then you want to have your safety after they're out of the water too. You want to make sure that you're washing them, because they can get bacterial infections, or the chlorine can eat away at their skin and cause irritants. And then you also want to make sure they're not really drinking the water. So providing fresh water. Chlorine can upset their digestion system, and the lakes, rivers, ponds, anything like that can cause a bacterial infection.
Well, Lindsay, this has been a lot of terrific information. Of course, we've got your telephone number and your website, and we always want to remind folks how important it is to come to the shelter, either donate to your friends of animal services, or look for adding that forever friend to your own family. And if you just close out by telling us how, what's the best word, enriching a pet can be to your family's life.
I mean, pets are amazing. I have 4. Pretty much everyone at the shelter has multiple animals. We kind of have a sweet spot for them. So I would recommend anyone to come down and find an animal. And if you feel like you can't have an animal in your family right now, just volunteer or walk the dogs or foster an animal. They're so incredibly enriching. They're so loving. And then you mentioned our website, and I'd also like to do our shout out to our Facebook page. Always follow us on Facebook. We have our events, our tips, and like you said earlier, pictures of the forever families, which is super uplifting. I know that when we're having a bad day, we always go on there and look at the happy pictures, and it makes us feel better.
Well, Lindsay Wolf, thank you for everything that you do and for the work that your staff does for our animal services and for our pet families.
And thank you for having me, Lisa, and for your dog at home.
Welcome back to Onslow County Today, and joining us is a new face to Onslow County Today and to Onslow County, and this is Stacy Scruggs. Stacy, welcome.
Thank you. Thank you for having me today.
Now, Stacy, let's tell folks a little bit about what department you're with and what your title is with them.
Yes, I'm with Onslow County Home Health and Hospice.
Okay.
I'm the social worker with the Home Health and Hospice Agency. We are under the umbrella of senior services, but we serve every age in the population. We provide home health care and hospice care for patients in their homes.
We were talking a little bit off camera, and you'd said you'd done this for many years, but you've been here with Onslow County just how long?
I've been hired with Onslow County for about 3 months.
Wow. We welcome you to Onslow County, and we welcome you to our community. And we want to talk about something that we've shared is just a growing need in our community, and something that you all at Home Health and Hospice and at Senior Services recognized, and then you immediately set about really meeting that need, and that is for a support group for our community members who have Parkinson's.
Yes.
Can we first let's define what Parkinson's is for our viewers who may not be familiar with it.
Sure. Parkinson's is a disease, it's a degenerative disease, so it's a slowly declining process that happens with this disease, and it affects the central nervous system. Most of the symptoms that you see with Parkinson's disease are related to motor skills. So it affects how we move, our joints and our limbs, our balance. It can eventually affect our mental status. A lot of times as Parkinson's disease progresses, those that have it may develop dementia. But a lot of what we see in the early stages especially is how it affects motor skills. People may see changes in how they're able to move their limbs, their arms, their legs. They may have trouble with balance. People have trouble with tremors. They may start shaking and have issues with holding on to things and just carrying out everyday functions because they're not able to use their body the way that they're used to.
You know, that's exactly the first thing that came to mind as you were describing the symptoms, the fine motor skills, and it affects your everyday, doesn't it?
Yes, yes.
Now, what you have worked to create with Senior Services and at Home Health and Hospice is a support group for those folks. Talk about a little bit about where you were hearing the need and then how you've structured your support group based on that need.
Sure, sure. As we're out in the community taking care of our patients, our staff, we became aware of the need for people that have Parkinson's to come together and to find support, not only from staff, but more so from each other. Parkinson's is a very difficult disease and it is a very hard disease for somebody to go through because they're losing their abilities to do things that they're used to doing every day. And we saw the need to start a group where these individuals could come together and talk about those things that they're experiencing. We didn't have anything like that in the local area, and we just felt that there was a need to get that started here for them.
You know, for those of us who are familiar with Parkinson's, we certainly think about the actor Michael J. Fox, and so he's kind of put a different face on Parkinson's. We oftentimes just thought of it as a condition that might affect our seniors, but really it doesn't have an age limit necessarily.
No, it doesn't. A lot of times the majority of cases that we see affect people who are usually ages 50 to 60 and over, but there are cases that start very young. It is not a selective disease when it comes to age. It's not.
You mentioned so much about that staff can only do so much, that an effective support group is one where the members who are dealing with a disease, the condition, are really oftentimes the best source of support. Talk a little bit about, if you can, what you've seen, and I know that you've had one meeting so far as you've organized this, the response of those first participants.
It was amazing. These participants that came had never met each other, and it was almost like they knew each other by the way that they were able to connect. It's one thing for us as professionals to be able to come in and provide support and education and those things, and those are necessary and important. But when you have somebody who can come alongside you and say, I understand, I'm there, I'm going through that, I've been through that, and this is what has helped me, this is what I've tried, this is what hasn't worked. That is something that is a gift that they are able to give each other, as well as knowing that they're not alone, that there are others who are struggling and going through this process, and to find that community of individuals to walk alongside each other.
You know, I was thinking as you were talking about when we do become ill, sometimes it becomes so much easier to isolate ourselves. And with a condition like Parkinson's, and we sometimes are embarrassed, as you mentioned, the tremors or the not maintaining our balance. It sometimes seems safer and easier to stay at home. But as someone who has worked in this field for many, many years, can you share with our viewers how that really is the opposite of what you want to do?
It's so easy to just draw up and to stay to ourselves. That's the easy thing to do, but we don't find support that way. Sometimes the hardest thing to do is to step out of our comfort zone in any situation, but especially in a situation like this where we're struggling, where somebody's struggling with real life issues, you know, being able to walk without falling, being able to get where you need to go because you can't drive anymore. All these things that all of a sudden are an issue, it doesn't help us when we draw into ourselves, but rather to reach out to each other, to people who are struggling with those similar things, and find that support, and be able to find somebody who does genuinely understand and can empathize with them.
You mentioned finding that support, and there's another piece of this puzzle, and it's that person, whether it is a spouse or a child, who then becomes oftentimes the caregiver for the person with the condition or the disease. And they oftentimes need support, perhaps a different kind of support, but they need support too. Can you share with our viewers the importance of caring for the caregiver?
Yes. Something that is so important for us to realize with caregivers of loved ones is their job is not a full-time job. In other words, a full-time job for us is 8 to 5. We start work at 8, we get off at 5, and then we go about our life outside of our job. With a caregiver, they are more than full-time. They are around the clock. They don't get off at 5 in the evening. They don't start at 8 in the morning. It's around the clock, and it's for a loved one, which makes it even that much more difficult, because not only are you their spouse or their child or their friend, you're having to take care of them too. And so you have all these roles that you're taking on. And so taking care of our caregivers it's so important. It's so important because you need to be there for that person. You need to be able to take care of that patient. And so in order to do that, you have to take care of yourself.
And sometimes we forget to do that, don't we?
Yes, yes. I don't know the percentage, so I don't want to misquote, but there is a percentage of caregivers who pass away before the people that they take care of because of the stress that comes with it and the issues that are a result of that stress. So, you know, part of what we do just even in home health and hospice is make sure that we're supporting our caregivers. And so what we've done with the Parkinson support group, we have set it up at the same time as our other support group that is for caregivers of individuals that have dementia-related disorders, which Parkinson's is one of those. And so our group meets the second Tuesday of every month at 2 o'clock in the afternoon, and that caregiver support group meets at the same time. So individuals who come, they can come to our support group for if they have Parkinson's, but their caregivers have somewhere to go as well. And that's so important for these caregivers too, to have people sitting next to them that can say, I know what you're going through.
You know, you've said that a couple of times, and I can't tell you how poignant that is. Because so frequently when someone shares something with us and you say, I know how you feel, and really, we don't.
We don't.
But in this case,
that's the truth.
They do.
And that's where the help comes. That's where so much of the healing comes and the support comes, is from having people that truly can relate to you.
Who really do know how you feel. Stacey, you mentioned that you meet the second Tuesday at 2 o'clock. Share with our viewers exactly where you meet and the location within Senior Services.
Yes, we're in the Senior Services building on Richlands Highway at 4024 Richlands Highway. We're in sort of a back room right now. It's kind of a maze actually to get to it. So the best way for somebody to find it would be just to come to the front entrance and to the front desk, and they will direct them how to get back to that meeting area. And they can call us to reach us at 577-6660, and we can give them directions on how to get to that area as well. But it's at the main Senior Services building on Richlands Highway.
Well, very good. Well, Stacey, welcome to Onslow County.
Thank you.
And thank you for bringing this for our community and for our citizens. I look forward to having you back and visiting with us again.
Me too. Thank you so much for having me today.
As always, we thank you for joining us for Onslow County Today, but especially today when we are celebrating our 15th anniversary. We want to thank our guest who joined us, Mr. Jeff Hudson, Onslow County Manager, Captain Donna Pauly with Onslow County Emergency Medical Services, Lindsay Wolf with Onslow County Animal Services, and Stacy Scruggs with Onslow County Home Health and Hospice and Senior Services. As we celebrate our 15th anniversary, we want to thank you for joining us as we've celebrated our county departments and the services that we bring to our citizens each and every day. And we remind you to get out and explore your Onslow County today.